And a hungry doctor is a dangerous doctor to a patient, because when you are not in a normal sense, you can't take care of your patients. We are using this opportunity to appeal to the public, to our patients, and to the masses, to Nigerians, that they should help us appeal to the government to be sincere in whatever, in their responsibility. They need to do the needful. All of them will have their own salary at the end of the month, and you have a doctor that have worked diligently, follow the procutical hold to the latter, and you are still owing the same set of doctors. It's wrong.
A large number of Nigerian doctors trooped to the Ladi Kwali Hall of Sheraton Hotel, Abuja yesterday, August 24th, to partake in an interview conducted by a consultancy firm for those willing to work in Saudi Arabia. The recruitment exercise was attended by medical consultants and senior doctors in various areas of specialization. Doctors in Nigeria have continuously complained about difficulties faced while carrying out their jobs. Some said they have resolved to use their money to buy materials needed for the sake of patients in need of care. It will be recalled that Nigerian resident doctors have been on strike for weeks now over poor remuneration and conditions of service. The strike action commenced on August 1st, 2021, as NARD's demands for negotiation over irregular payment of salaries, amongst other issues, have repeatedly fallen on deaf ears. Hence, the reason many were not surprised to see the number of doctors that showed up for the interview. Dr. Osikoya Oludotun, Publicity and Social Secretary of NARD, in an interview with Roots TV Nigeria, complained bitterly about the ill treatment Nigerian doctors are facing in the hands of the federal government.
We are not actually asking for a new salary. We are asking for our salary. Our due is our right. Because some of our members on the Give Me platform are being owed salaries between 4 months to 7 months across the 6 geopolitical zones of this country. Likewise, we have our house officers, the fresh young graduate doctors, they are being owed salary. Over 114 of them are owed as an and I'm talking to you. And what the government is saying, just say there are 2% of everybody that they look into it, forgetting that those 2% that they are accounting, they are a breadwinner in their own right. Some of them, their parents sent them to medical school and out of school thinking that they'll come and take care of them, and you are not owing them salary. Some of them are married, they have kids, they have obligations to pay for, and you are owing them, and you're not saying they're just 2%, which is somehow appalling. It's somehow, because the head of service now came out with a one annoying circular like that remove house officer from scheme of service. Now you're not saying, giving us a policy that is harsh, and you want doctors to stay in this country. How would they stay when you are not taking care of their welfare? You call us essential workers. You want to take care of your essential workers very well so that they can do the essential services. You are holding them salary. How do you expect them to be well? How do you expect them to be able to take care of their patients? Now you talk about a procutical hold. Fine. We saw a hold to take care of our patients, to be able to always be there for them. But that hold too has another section that says physician heal thyself.
It was gathered that this is not the first time Saudi Arabia is wooing Nigerian doctors with job offers. In March 2019, there were speculations that many qualified doctors left the country following a massive recruitment exercise that took place in Abuja, leaving the country with a handful of qualified medical practitioners. Efforts made by the House of Representatives to mediate between the federal government and NARD proved abortive, as the federal government insisted on a no-work, no-pay policy. Over time, many have questioned President Muhammadu Buhari's numerous medical trips, as it highlights the need to solve the nation's healthcare infrastructural and personnel challenges before Nigeria loses all her qualified doctors to foreign countries who have given them an enabling environment to practice their profession. Unfortunately, several years into this administration, nothing much has been done to improve the health sector, as several underappreciated qualified Nigerian doctors continue to seek refuge and greener pastures overseas.